Minimally invasive has really become a buzz phrase in spine surgery over the last few years. If I were to ask every one of my patients if they would prefer their surgery performed minimally invasively, I don't think I would ever find anyone these days that would say no. It certainly doesn't take a medical professional to understand that surgery that causes the least amount of collateral damage to surrounding tissues and still accomplishes the goal of surgery would always be preferable. But what does minimally invasive actually look like when it comes to spine surgery? This is not agreed upon even amongst spine surgeons. And nearly everywhere you look, you will see this term advertised and promoted. This creates some serious ambiguity and certainly leaves the patient less than fully informed on what's expected. Ultimately, minimally invasive spine surgery involves utilizing the latest technology, which includes special imaging equipment, robotics, and navigation, and improved diagnostic techniques to enable specific targeting of problematic areas. I'm fortunate in my practice to have access to this latest technology and the appropriate equipment to perform these surgeries. This means that whether it be nerve or spinal cord compression, or gaining access to specific sites for placement of spine hardware and bone graft material for fusion, there are techniques that now enable me to get the job done with less blood loss, less pain, faster recovery, decreased risk for infection, and earlier return to the activities that my patients want to get back to. There are an increasing number of problems that can be addressed with minimally invasive techniques: decompressions, fusions, and even some deformity procedures. For me, being passionate about minimally invasive spine surgery, it becomes a mindset, a way that you think about and approach each surgery. And it's a challenge that encourages me to push the limits in terms of enhancing my patients' recoveries. I'm passionate about minimally invasive spine surgery because patients do better. In my practice, I'm often able to work through incisions just over 1 centimeter in size to place small tubes down to specific areas of the spine with microscopic visualization to perform procedures that traditionally required much more surgical trauma. At the same time, there are some cases, for example, certain revision surgeries or large deformity procedures where these techniques are not in the best interest of the patient. And that's why, for me, it's so important to take the time to have these conversations.